But again, if we're looking through the progression of that patient, we can kind of see that. And maybe that's an opportunity for a query of a physician as well, to make sure that they're documenting appropriately. But also, and I think we talked about this before, when we were reviewing someone's critique of a physician. We had the physician and we had a coder, and they were going back and forth. And while I saw exactly what the physician said, because the way in which they documented it was there, but because it wasn't neat and pretty in a bow for the coder, they didn't. And I was like, that isn't a provider documentation issue. That's a coder understanding, validating, critical thinking issue, right? Right. Okay. So anyway, with your number and complexity of problems, you're looking at acute versus chronic, stable versus worsening, and any risk factors and complications. Again, that may not be nice and neatly written out in the assessment. It may be throughout the course of the documentation of that note. And so you need to be able to pull that information out of that to support that. Also, with our data review, we're not just counting tests, but you also need to understand why those particular tests were ordered and how the results may impact care. Again, this helps you clinically validate what's happening for this particular patient in this encounter. And then we have our risk. We're looking at the whole clinical picture at this point. Understanding what treatment risks are and any comorbidity impacts to this patient, based on, again, the assessment, based on the data review, and based on the risk that is documented within that particular note. So again, focus on the clinical thought process, not just, documentation elements. That again will help you tremendously in your career as a coder. So,